There is big news today in the two-year fight against the coronavirus. The FDA has approved the first pill to treat COVID-19. The pill is made by Pfizer. Research shows it to be nearly 90% effective in preventing hospitalization and death for high-risk patients who get COVID. And today's approval is considered one of the most significant developments during this pandemic. We know many of you probably want to know a little bit more about this pill. So joining us now live to give us some insight is Rebecca Nolan. She is a clinical pharmacy specialist with SSM Health at St. Mary's Hospital in Richmond Heights. Rebecca, we appreciate you being here.
Thanks for having me.
So today's approval is being described as long-awaited and a possible game changer. So how important is it that we now have a pill available to us to treat COVID?
Yeah, I think it's really exciting. The Paxlovid pill to treat COVID-19 can treat patients at home. And one really exciting part about it is it can hopefully reduce hospitalizations, which is really encouraging as our hospitals are filling up and our numbers are really climbing in the St. Louis region.
And can you talk about just exactly who this pill is authorized for?
Yeah, absolutely. So it's high-risk individuals who are age 12 and older who weigh at least 88 pounds. And these patients have to be positive for COVID. They're eligible if they have high risk for being admitted or high risk for death, and it has to be prescribed by a physician.
A lot of our viewers probably wondering, okay, when can this be available to me and where can I get it?
Yeah, it's a really good question. We expect that we should get distribution sometime next week, and it's very likely that you'll be able to get it at healthcare systems throughout St. Louis region, and potentially at retail pharmacies as well.
And so that obviously you're talking about pharmacies and then also hospitals around the region?
Yep, exactly.
Great. There is concern right now about testing supplies. We've heard a lot about that, which could cause delays for someone to find out if in fact they have COVID. There are some reports that indicate any delay could make this pill ineffective because it needs to be administered early on. Is that something we should be worried about?
Yeah, I definitely think that it's concerning, the lack of testing supplies. This medication specifically should be given within the first 5 days of testing positive. So we really want to give it to patients as early as possible.
And last question, we talk about the vaccines. Does this mean it might not be as important to get a vaccine now that we have a pill like this?
While the pill is really encouraging, the best way to reduce contracting the virus and spreading it is to get vaccinated. And if you're already vaccinated, to get boosted. And of course, we still recommend social distancing and wearing masks while indoors.